Well, welcome to this video and welcome back to Dr. Cohen, our resident general practitioner almost at the moment, I think, Dr. Cohen. So thank you for coming back.
Pleasure. Lovely to be here.
Now, we want to talk about a pretty serious issue today, that of over-medication. Sometimes when you go to the doctor, it's really almost an expectation that we get a prescription. It could be, a cynic might say, it's sometimes easier for a doctor just to write out a prescription, whereas what we want to do really is look at the person as a whole and have an inclusive whole life strategy of management, including nutrition and everything else that goes with it. And I believe today you wanted to look at the example of depression. And I've just looked at a few facts from the UK. 8.3 million adults in 2022 in the UK receiving these antidepressant selective serotonin reuptake medications. That's 14.7% of the population, 83 million prescriptions. Incredible, nearly 15% of the population, adult population. And that's gone up 35% over the last 6 years. Well, what's your feeling about this?
Very much on the rise. Yeah, it's very much on the rise, not just in the UK, obviously. It's a worldwide phenomenon. I would suspect it's more in developed countries, but it's also definitely a phenomenon happening in developing countries. And I think that it's concerning, partly because of what it represents, and partly because it also suggests that our strategies for dealing with this are perhaps not working so well. I think that we need to start looking at the root causes of depression and fully understanding what this entity is. And it has huge effects on people's lives. It has huge effects on countries, on economies. And so my feeling is that this is an actual call for action. It's an alarm. If you had any other illness that had those rates of prescribing and climbing so quickly, we'd be looking at this as a national or international emergency. And I think that we do need to look at the whole subject and not just say, well, you know, we have these drugs that could help and often do, but are somewhat limiting in their approach, let's say.
Are we agreeing that depression is a real illness? You know, you and me can be depressed from time to time. You think I'm a bit depressed today. But you get people where depression has taken over their lives and is completely pathological.
Yes, I mean, first of all, depression is very real and it's all too common, unfortunately. I think that I think that there's, with the way depression is diagnosed, there are criteria. But I sometimes wonder, as a family doctor, if the criteria are putting us into a box where we're almost forced to prescribe. If someone meets the criteria of having 2 weeks of, yes, fairly significant symptoms, it's almost incumbent upon us to prescribe a drug. Now, I'm not saying that the drugs aren't very important. They certainly can be, but they shouldn't be looked at in isolation. And I've got many stories of people whom we've managed to delay just by talking. And sometimes a simple conversation is enough to help somebody get through another week and another week and another week. And by then they get past things, or they find a new strategy. And obviously the conversation isn't just about listening, which it's very much about, but it's also giving certain tips. And we will touch upon those, I hope, in the video, the kind of things that can actually help may, first of all, yes, a person may have a life reason for the current episode of depression, but it could be that they've also got a susceptibility or a predilection for it. It could be that they've got low levels of certain vitamins. It could be that their thyroid is not functioning well. There are various things that can, let's say, add to the mix and make it more likely that someone's going to need to to require an antidepressant medication. And taking an antidepressant medication comes with various factors that we need to take into consideration and concerns, because they're not completely innocent in the sense that they do have side effects like all medications. And people, by the nature of these medications, they need to take them for a minimum of 3 to 6 months. And many people end up taking them for many years, and the side effects are cumulative. So they often cause weight gain, or they cause problems with sexual function. They cause a numbing of emotions, which is a part of the reason why they can be effective. But we need to take all of this into account, because on the one hand, we're trying to help somebody to get better, and on the other hand, we're potentially causing harms in other ways later down the line.
Before we look at the strategies that you do, I made the mistake of saying alternative strategies. They're not alternative strategies. They're strategies that we should be using in addition to medications. And I know you've got
Correct.
some really
Correct.
important things to tell us on that. But before that, just tell us a little bit about these antidepressant medications themselves. What group of drugs are they in? What names of drugs are we talking about?
So most people have heard of a drug such as Prozac. I mean, this was like one of the first and most famous ones in going back probably around 30 years now. But before that, there were others. And if I remember rightly, I think Prozac was discovered somewhat accidentally as to its effects. The class of drugs is generally known as the SSRIs, the selective serotonin reuptake inhibitor drugs. But there are other classes like SNRIs, which are selective norepinephrine reuptake inhibitors. And there are others I'm not going to go into, like tricyclics, and also other classes of medications that can be used. But the ones that people know of by name, as in brands, in which I hate using brand names, but fluoxetine is known as Prozac. Sertraline may be known as Serenada. Paroxetine has other names like Paxil. Those are the kinds of medications that we're talking about. Yeah.
And do these actually have some effect? I mean, my experience is that people start on these medications, and I'm happy to be upfront about this. I've taken a course of fluoxetine a couple of times myself, and what I find was, and talking to many other people, they tend to make you worse for a few weeks, and then you do notice a bit of an improvement. Is that a fairly sort of typical pattern that you see?
What often happens in the beginning, and we are aware of this very much as doctors, is that very often when they are started for the first week or two, they can actually cause an increase in agitation or anxiety. And so very often we have to prescribe a concomitant medication to prevent that becoming an overwhelming problem, and either causing the person to stop the medication or to actually become worse in some ways, because if it increases a person's agitation at a time when they're feeling incredibly low, it increases their susceptibility to potentially harming themselves. So we are aware of this, and this is something taken into account.
So sometimes that might involve a short course of benzodiazepines, for example, the Valium type drugs.
Correct. So exactly, a benzodiazepine like Valium or clonazepam, these are the kinds of drugs that can be used. And again, they also have risks. So we can only prescribe very short courses. They're to be used for very short periods of time because they themselves are addictive or potentially addictive. It can cause dependency, and people can get used to them and need higher and higher doses. And very briefly on that subject, even the SSRIs, even though we are told that they're not addictive medications, and in some ways they don't meet all the criteria for addictive medications, certainly some patients have great difficulty coming off them when they need to come off them after they've been on them for whatever, 6 months or a year. There are some people who very much struggle to come off them.
Benzodiazepines, we're looking at much shorter courses. You and
And,
I have seen many lives ruined by
yeah.
benzodiazepines.
Mm-hmm. Yeah, but even SSRIs, we have to be very careful and mindful of the potential for the fact that it can be difficult to get people off them as well.
So we've got this huge problem with prescribing SSRIs. I mean, if someone's depressed, is there an alternative? Or is there something we need to do as well as?
Well,
where do we go with this?
First of all, I'm not saying that people shouldn't get medications. I'm not saying that at all. And certainly many people will benefit from medications. They don't work in the way that we initially thought that they did many years ago. There's the classic idea is that they increase serotonin in the brain, and therefore that's the kind of happy hormone, as it were. And for many years now, we've known that that's not correct. But they do certainly have effects on the brain which can be positive, meaning they induce what's called neuroplasticity. So they improve neurogenesis, which means the growth of new neurons, new brain cells. And this can help the person over time in the right situation to develop better brain connections in order to recover from depression and to become better. However, there are many other factors that can be involved with helping a person who is depressed, and alongside that, I would say with anxiety and also other mental illnesses. And some of these, for example, include doing simple blood tests to check that their levels of certain vitamins are normal. I can think of patients of mine who have really shocked me when I just found out that their vitamin D level was low, and rather than giving them an antidepressant, they chose to take vitamin D, and the effect was absolutely dramatic. They'd been low for years. They were not suicidal or anything like this, but everything is cumulative, and if you want to help somebody to get better, you have to look at all aspects of that person. And so I've seen people literally with vitamin D sometimes feeling dramatically better just by taking vitamin D.
So a life can be basically transformed by such a simple intervention.
Sometimes, but sometimes it takes more than one thing. Often it takes more than one thing. I'm just trying to say that we should be looking at all aspects. I've seen people with B12 deficiencies, iron deficiencies, similar kinds of stories that if you get their levels up to optimal levels, and obviously you need to find out why they're deficient, they may need other tests or whatnot, but simply by addressing all of the factors that might lead to a predilection or an actual depression, you already increasing the chance of the patient getting better for the right reasons, not just saying, okay, well, I'm going to give you this medication and this will numb things to some extent and you'll feel better. And yes, it will. But often that effect will wear off at some stage for most people. Whereas addressing the physiology would make a lot more sense.
I just wonder how often in the UK that is done. When someone goes to the doctor or the nurse practitioner with depression, how often do they do a complete examination looking for possible physical causes, doing a blood profile, looking at things that are simple and correctable? Because to my mind, the most fundamental mistake you can make in psychiatry is to say that a condition is psychological, psychogenic in the mind, whatever it might be, when there could be a physical, biological cause. And we have to get rid of those simple biological causes first. And I really appreciate that approach you're using.
I think that you'll find more and more that both psychiatrists and neurologists today are recognizing the, let's say, the interdependency of one on the other, and the connection that at the end of the day, psychiatric problems are neurological problems as well. And I'm not trying to say that everything stems from a neurological problem or that everything neurological stems from a psychiatric problem. I'm just saying that they are interconnected. The mind-body connection is very much alive, and we need to be aware of this. Things like if you notice, even if you, if you had a tooth extraction and you felt low for a couple of days, the inflammation that's induced by pulling out that tooth and the bacteria that's sent around the body at the time of this relatively minor operation is actually quite significant and can induce a short-term, call it depression. So we know that there are inflammatory factors, and that goes down to food intake, what kind of foods we eat, if we eat lots of ultra-processed junk food, or if we eat whole food that as close as possible resembles to what came out of the ground. It makes a huge difference. If we sleep enough, it makes a difference. If we do sport, it makes a difference. Sports has been shown. I mean, there are studies that show there's something called brain-derived BDRF, which is brain-derived something factor. It lost me for a second. But this is something BDNF, brain-derived neurotrophic factor, and this. This is actually something that improves neuroplasticity as well. It improves neurogenesis. And it's been shown that by doing sports, this is something that goes up dramatically in the brain. So the point being that we should be looking at everything, not just be saying, well, you meet these criteria for depression, and therefore we're going to give you this drug, and we'll try and arrange some counseling as well. We need to take a much more wholesome approach to this, I think.
Yeah. So is it you're talking about sport there, is it the sort of social interaction in the sport, or is it the exercise, do you think, that's mostly helping, or is it both?
I think it's both. That would just be me, my opinion standing on one leg, but I definitely think it's both. And so to come to the physiological side, I just mentioned about BDNF. But if you look at the social aspect, again, this touches upon many things. It's the idea of working in a team, the idea of playing a sport with somebody, actually having a social interaction with someone, developing that kind of friendship or relationship together. I'm sure that that's a significant part of it. And on that subject, I would also go to mention about human connection and how important that is in preventing and treating depression. We're living in this very technological age, and the devices, the amount of time that people spend on their devices, and alarmingly children included very much, but people of all ages have become the focus has become very external. Once upon a time, a person would sit with a feeling. A child would sit with a feeling. They might be upset, they might be happy, they might be angry, but they became used. We were more and more in touch with our own emotions and with our own realities that was coming from our own inner worlds. And today, a lot of that has been so-called replaced by external stimuli, such as devices. So people let's say they have less exposure to real relationships. They have relationships with electronic devices. And this means that our ability to process things, our ability to feel contentment, our ability to feel happiness it has to be blunted by the very fact that it becomes dependent on an external source. If we don't have that external source, whether the device or what we watch on it, then we're at a loss to know what to do with ourselves, right? And this in itself is a significant problem, but it all comes together with the idea of human connection.
And you can have a ludicrous situation that I've seen quite a few times myself. You'll go around to a friend's house and you might have the husband upstairs on the computer and the wife downstairs watching something on TV, and maybe the kids in another room doing something on phones. And it's a real.
How often have you been to a restaurant, John, and seen that a whole family or a bunch of friends are sitting on the same table and everyone's on their phone?
Just a minute, Michael.
I'm like, why are you all here?
Yeah. And it's so impolite. I mean. At work, for example, when I was a young staff nurse, we used to have coffee breaks, and they were interactive and we'd talk. But
Yes.
working recently, going back to clinical work part time, you go into the coffee room and everyone's, and it's just
Yeah.
so it's a whole aspect of
Yeah.
life. There's questions I want to ask. You want to interact, and they're fiddling away with a phone. It drives you mad. Apart from being impolite. So I think we've got
Yes. Yeah.
some really important factors here. We need to reduce inflammation. Inflammation can lead to it's a factor in depression, and we know we can do that by cutting
Very
out
much a factor.
ultra processed food. Does alcohol help if you're depressed, Michael?
Well, alcohol would, if you believe the label, it's something that is enjoyable. And yes, it can be enjoyable, but again, it needs to be even probably less than in moderation. Alcohol in itself is a depressant drug. So at the time that someone's drinking and while they're feeling somewhat intoxicated or very intoxicated, they might be having a great time. And I'm not here to suggest that no one should ever drink alcohol. But I think the amount that it's drunk, and I see this all the time. I speak to patients of mine, and they're on antidepressants sometimes and other medications. And just by talking to them about the amount that they drink in terms of alcohol, it's clear that the alcohol is counteracting the effect of the antidepressant. So they're not even getting the full effect of the antidepressant. But aside from that, someone who's not on an antidepressant, but who does drink alcohol on a regular basis, it does cause a depression in mood. It affects sleep quality, which again contributes to that. So yeah, I think it is a factor in this.
Yeah, and even the alcohol itself, the breakdown products are more toxic than the alcohol. And these toxic products are circulating. It's going to increase overall inflammation. I think we know this. So it's
For sure.
avoiding
sure.
ultra processed food. It's drinking in moderation. It's really trying to get a grip on technology. It's human interactions are the most important thing in life. Surely, we need to prize these things. Take enjoyment from them and give to people around about us as well. And I think we benefit so much from giving as well as from receiving, and that's all part of these interactions that so often we're just missing out on. So it's multifactorial. Do you think there's a place for professional psychological interventions, thinking of things like cognitive behavior therapy and person-centered sort of Rogerian counseling type therapies? Has that got a place?
I think definitely there's a place for it, and I think that we should be utilizing those resources. I think looking at the scale of the problem as it is at the moment in the UK, worldwide, I don't really see how it's possible to cater for everybody with cognitive behavioral therapy or whatnot. But I do think that even a kind word, even a smile, going back towards more community-based things, getting rid of, let's say, limiting the use of phones, whether it be in the workplace, whether it be with children. I've never understood why a child needs a smartphone. What's wrong with a simple phone that they can send a text message and be in touch with their parents? I fully understand why parents nowadays want to be able to locate their child or whatnot, or in the event of an emergency or whatever. But it just seems like the balance has gone way, way, way to the other side, and not for the benefit of the child. There are clear studies showing that even not even an hour a day of use on one of these devices is actually damaging the child's neurological development. I mean, this is not something. It's something to be taken extremely seriously.
Do you think there's quite a lot of talk now about microbiomes, prebiotics, probiotics? Do you think, are you a believer in the gut-brain axis?
I'm not a believer, but I've seen evidence. There's
better.
at least 11 different types of
Yeah,
There are at least, I mean, it's not yet a religion as far as I know, but
no, quite
there
right.
are at least 11, there are 11 species of bacteria that have been shown to be very commonly associated with people with depression. I think the whole subject is fascinating. I think it's going to be the future of medicine. I think that, and that includes psychological medicine as well, psychiatric medicine. I think that we are very much in our infancy about how much we understand about the gut microbiome and how to manipulate it. But I would say this: the basics are the easiest, and we should be following those. What does that mean in this context? I think, again, it comes back down to eating healthily. What does eating healthily mean? It just means eating whole foods, not eating ultra processed foods. The moment we start eating better, our gut microbiome is happier. Maybe we'll do a video about this sometime, but for example, I do a lot of experiments on myself, John. And one of the experiments I do is I monitor from time to time. I have a monitor that sits on my arm, and I can check my glucose levels 24 hours a day. And I can see the readings, what's coming up, and I can see everything that I do, whether it's sleep, if I drink water, if I go for a walk, what foods I've eaten, what sports I'm doing. I can see the immediate effect on my glucose levels. And by inference, it would suggest that, well, I've just eaten this particular food and my glucose level is shot up, and I've eaten another food and it hasn't. And this, for example, is a great way of seeing whether my gut microbes are happy, as it were. Because when they're unhappy, you see your glucose going all over the place. And this is an important part of our human metabolism. So I do think that the gut microbiome is incredibly important. And we know that it influences mood.
Yeah. And a wide variety of foods, different sorts of fibres going to hopefully feed the right bugs in the right direction. And
absolutely, yeah.
Basically, a lot of people now are saying the microbiome is almost like an additional organ. It's something that influences so many different things.
Well, if you look at it phylogenetically, it's more true to say that we are living inside them than they are living inside us.
Indeed.
They preceded us or precede
Indeed.
us, and they outnumber us as well. So
significantly.
it seems like sometimes I wonder, and I sometimes wonder who's serving whom.
Indeed, yes, good point. Yeah. So I mean, we've got some really basic things here. The basic medical interventions, the basic blood tests, the correction of deficiencies, the diet, cutting down inflammation, really making time for sleep, not using bright lights at night, thinking about technology, valuing human interactions, psychological treatments, talking to our friends, talking to counsellors if necessary. The last point I wanted to take your opinion about, Michael, is depression it's always been, I mean, if we think back to the Old Testament, King Saul had periods of depression, and David played him the lute to alleviate his depression. This has been part of human history throughout the millennia, as long as it's been recorded.
And a great Leonard Cohen song as well. So
yeah, so all Leonard Cohen songs, I would say, reflect depression. But he's not a relative, is he?
No, not that I'm aware of.
Yeah, you probably have a great grandfather somewhere or other. Now, the serious point is depression sometimes, in a strange way, an opportunity?
Absolutely. This is something we've spoken about, you and me, before, and I think that it's very often, sadly, an opportunity lost. So I think if you speak to anyone who's gone through a depressive period in their life, it's definitely an opportunity to reflect. If you think about what's going on in depression, the brain has basically, or the mind, whichever way you want to look at it, has been overloaded in some way for a significant period of time. And a person has come to a point when they just can't cope and they literally want to shut down. And that's what the depression is. If I was to look at it if I was to stand back and say, what's going on with this person? The person has become overloaded. They simply can't cope anymore. And it's our brain and our body's way of saying, wake up, you need to stop the things you're doing at this moment and take a serious rest. And a rest, I mean, it's not a rest of just going to sleep or going on a holiday. Far from it. It's actually it's about getting to know ourselves. It's about being able to recognize what's actually going on in our minds, what's going on with our emotions, what's going on in our lives. How do we process things better? How do we think better? And if I go down the medical model on its own, which is, okay, the person is feeling awful. Me as a doctor, I need to make them feel better quickly, because otherwise, heaven forbid, they'll feel awful for longer. Well, that's one approach. I think that there are other approaches which would say, how can I guide or help to guide this person to find their own strength so that they don't become helpless and dependent on me or on a medication on its own, but that they understand that this is a part of a process, a much bigger process that they can use for their own advantage, develop resilience, become stronger people, and hopefully never need to come and see me again for this, but be able to use their own internal resources. And there are so many good things that can develop from that, so many enriching things that can develop from that kind of an approach. So I think whether someone uses a medication or doesn't use a medication for depression, it's definitely an opportunity to grow, and that's very much, I think, a good point to bring up in this video today.
Yeah, no, I agree completely. Yeah, that's great. Yeah, it's quite profound, really. Yeah, a lot to think about there. So, Dr. Cohen, thank you very much. Amazing insights. Some things I'm going to apply in my own life. Actually, I've been challenged actually by some of those points, particularly the technology when it has to be said. As always, never take a medication, never start a medication without consulting your own healthcare provider. This has been a purely academic discussion. If you find it helpful, that's great, but always go through your own healthcare provider before making any changes to your life. And on that, thank you from me, and thank you, Dr. Cohen, and hopefully we'll see you again.
Well, I hope this has been useful for some.
I'm sure it has. Yeah, well, it's been useful for me. But, if it helps one other person, then that would be worthwhile. Thank you.
Take care, John.
Too.